So now looking at the foot, we can see if we remove the calcaneal tendon and the soleus muscle there, that here we have the tibial nerve running down the posterior compartment and the posterior tibial artery. There would normally be two veins travelling either side of that artery, which again are posterior tibial veins, but they're not shown here on the model. So normally that neurovascular bundle would have at least 4 structures, but here there's only 2. So tibial nerve, posterior tibial artery. Now, the good news is that both of those structures split into medial and lateral plantar structures. So the tibial nerve splits into a medial plantar nerve and a lateral plantar nerve. Now the lateral plantar nerve you can see quite easily here running over the quadratus plantae muscle. The medial plantar nerve actually splits just here, so technically it's really only the medial plantar nerve here, and then it's already split into a couple of branches by the time we get to the to where the quadratus plantae would be, or the flexor digitorum longus tendon here. So, but the blood vessels, the posterior tibial artery splits here into a lateral plantar artery and a medial plantar artery. And again, we can follow them. They travel with the nerve, so they're not too tricky to find. Again, though, on a specimen, there would be veins travelling with them, so there'd be medial and lateral plantar veins as well. Now then, if we look on the dorsal aspect, we can see, oh, this is lovely, we can see here a couple of branches of the superficial fibular nerve. And those ones are just great. You can see them there really, really well. What we can also see before we even remove anything, though, is the deep fibular nerve just here, which is great. And then it emerges again between the first and second metatarsals here. You can see the deep fibular nerve there again, just there. But then if we remove some of the anterior compartment muscles, mentioning, here we've got the anterior tibial artery and the deep fibular nerve in the anterior compartment. So the anterior tibial artery becomes, and we can just see it under the retinaculum here, the inferior extensor retinaculum, becomes dorsalis pedis once, or dorsal artery of the foot, once it passes the talocrural joint, and that line would be about there. So this is dorsalis pedis here, but this is anterior tibial artery here, and here we've actually got a perforating branch of the fibular artery too, which is quite nice to see that coming, and an anastomosum with the anterior tibia. Now then, we can also see, if we look further along the dorsal surface of the foot, we've got the first metatarsal artery here, and we can see some of the dorsal digital arteries here. That should be dorsal metatarsal arteries, sorry. We can see some more dorsal metatarsal arteries here, between in the spaces between the metatarsals and the long extensor tendons. And we can also see some dorsal digital arteries and nerves along there in between the toes as well. Does anyone have any questions? Did I miss anything important, or no? Okay, please grab specimens. Look at as many as you can, and